Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Vernakalant. Vernakalant is a multi-ion channel blocker. That means it will actually block the mixed potassium and sodium channels. It is a mixed potassium and sodium channel blocker. So this is used in the acute attack of atrial fibrillation. And it is used in arrhythmias, obviously. This Vernakalant is actually contraindicated in advanced congestive heart failure, and it is also contraindicated in cases of recent MI.
thank you and thank you for watching.